This mini-module will introduce you to two common research approaches in health science, case series and case control studies. Don't be fooled by how similar they sound. They are two different approaches with differing goals and methods. Here you will begin to see that different approaches can answer different types of health science questions, and you can begin to consider which approaches may be the most appropriate for your final research proposal. A case series describes a usually small group of patients who have the same disease condition or who have undergone the same procedure. The primary study question is, what are the key characteristics of the cases in the study population? For example, researchers may want to know, what are the key characteristics of people experiencing synthetic cannabis intoxication? This study approach is particularly good for characterizing a relatively new or rare disease or exposure. For example, the researchers of the synthetic cannabis study were curious about this exposure because it's relatively new and not much research has been done on it before. A case series approach would not be good for studying a disease or exposure that is already well known because it's not powerful enough of an approach to give us new information. For example, we don't really need any more case series studies on the common cold. We already know what the symptoms look like. This study approach can also help to clarify typical disease progressions, especially for chronic diseases that may be worth characterizing in terms of how it changes over time. It can also help to develop hypotheses for future research, perhaps identifying new, unexpected reactions to synthetic cannabis, for example. Will lead scientists to hypothesize about how this chemical acts on the brain and design perhaps an experimental study to confirm their guesses. One of the first things to consider for a case series study is whether there is an available source of cases. Since this approach usually examines rare diseases or exposures, it can be really hard to find cases to study. Often it requires partnership with a specialty clinic or community. Just as importantly, we must consider whether we have a good rationale for conducting a case series in the first place. Since this approach usually generates small amounts of data, and it can only describe diseases, not tell us what causes them, it's not a very powerful approach and should be avoided unless there is a very good reason to use it. That reason is usually that the disease or exposure is so rare or new that we need to describe it before applying any other study approach. Lastly, we should be careful to define the disease or exposure really well so we can accurately characterize what we're studying. Where do we get data when conducting a case series? This approach might involve data gathered directly from patients through interviews, questionnaires, or qualitative techniques like observation. It can also involve existing data, such as patients' medical records. Even if you are using only medical records, however, it can be useful to create a questionnaire that systematically guides the extraction of information from medical records. When conducting a case series, you must be really careful about lack of generalizability. In other words, the small number of cases you describe may not be representative of the target population. Therefore, there must be a really good rationale for why you are choosing to conduct a case series instead of another type of study that allows better generalizability. Even when you do have a really good rationale, you must be careful in your interpretation of your findings. You cannot claim them to be general truths without further study using more rigorous approaches. And lastly, case series researchers must pay special attention to the protection of the identities of participants, especially if the disease being described is rare and each patient is at higher risk of being identified. So in sum, to better understand how case series studies work, you will read an article by Harris and colleagues published in 2013. The assessment in this module will probe your understanding of the study's methods and findings.